So, welcome to Greenfield's Connecting During COVID. These video interviews are designed to help us connect as a community of faith and share ideas and stories of interest and inspiration. And today I'm talking with Dr. Troy Janzen, a registered licensed psychologist. So, welcome to our video cast, Troy.
Oh, it's great to be here, Tyler.
So now, Troy, we've known each other for a long time, since I believe like 1997 when I started teaching at Taylor University College, and you were an adjunct teaching psychology there. And so I know you quite well, but not all of our viewers will be familiar with you. Perhaps we can start by having you share a bit about yourself and your training and qualifications to speak to some of these issues.
For sure. So I've been actually licensed as a psychologist since 1993, and I've been, done everything from private practice for about 15 years, and then I started teaching, and in fact ended up teaching full time at Taylor University College for 8 years, I think it was 7 or 8 years, and then after that, I did work at the University of Alberta in the graduate program, and my area of specialty is working with children, school-age children and adolescents, working with parents and providing services in those areas. After working at the U of A, my latest job has been working as the college's deputy registrar and complaints director for the regulatory body for psychologists in Alberta. We're all been adjusting to trying to give guidance to all psychologists in Alberta on how to respond to the latest crisis we're all facing in relation to COVID. And so there's that. So, but then a little bit about me personally is that I'm a father. I've got three boys between 16 and 21. They're all sports-minded guys who love playing football, and that's another thing that connects Tyler and I is that we both love football and love coaching. I've done that for about 8 years, and my youngest is still playing for high school football, and so that's a big passion in our family. I love playing board games together, walking our beagle, and so just a little bit about me.
Great. So now, during this time, like words like social distancing, isolation have been bandied about quite a bit during this crisis, and many have started talking about physical distancing instead of social distancing, since it is perhaps more accurate. It doesn't have some of the same unhealthy connotations, and so. But it doesn't matter what you call it. The stark reality is that we're not able to have the same social contact that we are used to. And so, do you have any tips on how to deal with the stress that comes from this isolation during this time?
Yeah, and I actually think that the term physical distancing is better than social distancing, and I think that how we label things actually does matter because to say social distancing implies a sense of isolation, and I think that that's one of the things that we are not required to do. We must keep physical distance, but we don't need to keep social distance. And so I think the technology we're on today, right now, is an example of how we can continue to be connecting with each other and how important it is. We're built as social beings, and we must stay connected in some meaningful ways. It's just that we're going to have to adjust and get used to some of the new methods of doing this, but there's also the old tried and true. And so I do think that during this kind of time, that continuing to find ways to connect and make plans to connect, and being open to some of the newness of that. I was telling Tyler earlier how I participated in my first virtual birthday party where we all sang collectively as a family from across all parts of Alberta and even another province to wish my cousin a happy birthday. And then we had 44 people from as far away as Germany participating in a retirement celebration for somebody. And, we couldn't get together physically, and that was a bit of a sadness and a loss to that. But the ability to connect is still there. And so it's important we be comfortable still trying to take advantage of that. The other thing I think it helps is to remind ourselves that this is temporary. But anytime we face anxiety or stress in unusual circumstances like this, it's important to help with our anxiety to remind ourselves that this is a temporary shift. We don't know when it's going to end, but we do I think if we get stuck in dwelling on that current situation, it actually makes it worse for us instead of better. So those are a couple of things that I would say
Yeah.
about that.
Yeah, someone I was just reading recently, and they came across this quote where, where understand your soul needs friendship like your lungs need air, and I do think that even the most introverted among us needs some connection, and so it's and we still can connect, right? Like and in some ways it's kind of neat that we can connect a little bit better for some cases, where like on Sunday we had a communion service on Zoom, and there was a couple there that had been shut in for quite a while who were able to participate in that. So that was amazing. That was great. So
Hmm.
um so, okay, one of the other realities, and you've all already mentioned that you have three boys, and I assume that they're around the house a little bit more than normal, and then of course Juanita is there too, and so many people are working from home now, and so do you have any kind of relationship advice for those working at home and being around one another 24/7? Like, like, yeah, it's probably creating a lot more tension in relationships. Uh,
Well, it might, and I think that the saying often has been, does familiarity breed contempt? And I think that the answer to that is actually not really, in that depending on what you mean by familiarity, because just spending more time with people, in general, the research says that helps you to feel more connected and closer to another person. Um, it's why people who share time in the same church or who work together generally develop some form of bond with one another. But what's true in this kind of unusual circumstance is that there's also stress and tension already existing, because there's worry, and there's normal worry and normal anxiety around what we're facing. There's real threat, real risk, and it's not we have to be realistic about that risk, but there still is that real sense. And anxiety is a normal human emotion. So what happens when you put people that have underlying anxiety and tension in a forced situation to hang out together for extended periods of time is that one of the things I know to be true is that when we're stressed or when we're anxious, those who are closest to us are the most likely to experience the negative aspects of that feeling. So how does that come out? Maybe in being a little snappier, a little more irritable, short-tempered, maybe more judgmental around how we are all responding differently to the same stress, even though it's the same stress for all, presumably. How we're responding to it might be very unique, and there's a lot of differences in how we react to
sure.
that stress. So are we more inclined to offer that listening ear? Well, we might, but sometimes what happens is that our stress and anxiety bleeds over. It spills over, and whoever's closest could bear the brunt of that. And I think that that's one thing we have to guard against. And um, the good thing about being in relationship is that we can share one another's burdens, and that's the positive aspect. If we just simply offer listening ear, support to our loved ones or those that we're in relationship with when we're stuck together. But when there's anxiety and stress underlying, sometimes what you have to do is you have to control how often you're dwelling on that particular stressor. And so I think that you need to have a planned time alone, even when you're stuck in the same house together. Solitary activities that you all agree is there's time that everyone needs on their own to do their own thing for a bit. Time that's together, sticking to as much routines as possible, and and then I think, but also planning some time together, and even some time where you plan to worry. And I think that may sound contrary to what you might think, but what we know about worry is that you can't stop worrying. So it's no point in trying to stop. But what you can control is how often or how much you're going to allow yourself to dwell on a particular subject. And one of the risks here is that we are bombarded with media and instant access to information, and not always good information. And I
Yeah.
think that it's important that and a lot of the advice is limit how much you're getting access to that kind of information. And so I'd say plan a time where you say, well, we're only going to watch or listen to real, information we find reputable and that's good information. Like maybe the chief medical officer's talk, we'll listen to that once a day, and then we'll sort of think and we'll pray about it, but then we're not going to really going to dwell upon it for a long time. But if you do want to talk about it and you both agree, there's nothing wrong with supporting one another in that. So I think it's a balance, right, in terms of how to best support one another when you're stuck together in a time of stress and uncertainty. So.
Yeah, no, I think that's great. Yeah, like limiting and choosing carefully what you sort of access in terms of the news, I think is can do wonders for your mental health. So I guess for if people are struggling to sort of care for themselves, right? So I'm thinking of self-care, but then also for others from a mental health perspective, I imagine that this could and the stress connected with this time could be a little bit of a trigger, for sort of, our natural or the way that we stress, or if someone has a mental health uh, issue or struggle. So, is there, uh, how can we care for one another, I guess, during this time, if someone who we're isolated with might be, and might have some sort of struggles like that?
That's a great question. And so I think one is to expect that some amount of anxiety, maybe even sadness, and the symptoms that go along with it is normal for all of us. So if we accept that in ourselves, maybe it's easier to accept it a little bit in others. But you're right that for some individuals, there might be more of an intense reaction, and it can affect more people around you. And that's that displacement that I mentioned earlier, where um, those that are closest to you get to bear the brunt of the symptoms that come with that, the irritability, the sadness, the not not having energy, feeling just blah or fatigued, or those kinds of symptoms, right? And those kind of things might be normal symptoms to some extent when you're faced with a stress. And for some individuals, this can be a tremendous time of stress. They might have lost a job. They might have uncertainty about when that can renew again. They might be realistic worry about where their finances are going to come from. And what we find is that what helps in this situation is when we can't control certain things. There's two kinds of coping, and both can be helpful. One is active coping, and this is where you're actively working to problem solve on the things that are realistic problems you're facing. So you're facing challenges around jobs or money. What can I do actively to do some things? You can research what programs are available through the Canada Revenue Agency. When can I access those resources? When can I apply? Can I begin that process? All of those are active steps that one can do. There may be other active coping strategies in here. How can I call the bank? Can I defer payments? What can I actively do to deal with the problem itself one of the problems I'm facing? The other part of the problems that we face, so sometimes, are those uncontrolled things. Like we don't know what the future of where COVID's going, or how long it'll last. So when things are outside of our control, passive coping is okay. And these are things like relaxation, losing yourself in a good book, and then what you find coping and relaxing might be individual to you. We know that there's some things that are probably less healthy for us than others to engage in, and so we have to guard against coping through passive means of trying to drown our sorrows in substances. That would be something that will create a new problem for us, and now we have to actively cope with that. So it's important that that we allow ourselves some time for downtime. We allow ourselves some time to actively cope, and we structure our day in a way that we're trying to take on a task each time. So I'm doing something meaningful. And that's for those that may be without a job and they're not working from home. They're just finding that they're isolated. And For
Right.
those that are working from home, staying to your routines, and then in the other downtime, taking advantage of some of that time in different ways. Uh, if you have more time than usual at home, what can you do? Uh, there's lots of things that you might do. You can reach out to others that you haven't talked to in a long time. You could take on projects or that you not touched for a million years. Like I finally went through all the photos of the last year and started doing, organizing them. And it's just stuff I've never really had to do because it just sat on a computer forever. And it's just now I'm home more often than I've been because I'm not able to go out. I have opportunity as well. I can see it as opportunity. We're deliberately making family plans to game together at least once a week and twice a week preferably, and so we enjoy that. And so we just ask everyone to carve out some time for that so that we're deliberately planning something that's more enjoyable. We're divvying up some of the family duties. Everyone takes a turn in my house with cooking, and some enjoy it more than others. Um, but and those those are the kinds of things that I think that it's important that help ourselves as much as help others to encourage them in those kinds of ways. And if you get to a situation though where somebody's experiencing intense feelings of sadness, feelings of helplessness or hopelessness, feelings of constant anxiety and worry and stress and tension that's distressing, and they can't cope with it, then they need professional supports. And you can still access professional supports despite COVID. And I think that's the real important message, is that psychologists are still accessible to you. They've all been shifting mostly to this media, this kind of medium. It's variable what they're using, but it's still possible to connect, and it's still meaningful. Even if it's not in person, it's still meaningful.
Yeah, and you have a number of resources that you've brought together that I'll make sure to put in the description of this video, and then on the web article connected to this video as well. Are there any in particular you want to highlight now?
Yeah, the only one I'll mention is actually the Psychologists Association of Alberta has a disaster response service where they're offering services for free. And the priority for that disaster service is providing psychological services, especially targeting those who are working in the health industry. But I think that it might be broader than that. The way they've advertised it is it's not restricted to only that. And so they engaged this program after the Fort McMurray fires. Actually, was the first time they offered this for families who were facing the displacement and loss of home, and sometimes 2 to 3 years of not knowing their future. And I think that was one of the first crises that the psychologists in the province chose to rally in this way to provide free services, because many people didn't have the financial resources. And I think that's one
Right.
I'll mention. And I'll give Tyler the phone number, but it's easy to look it up on Google. Just a Google PAA disaster relief, and you'll be able to find the phone numbers and how to contact them to see if you could get access to that service. Now, if you have resources though, and you can afford services, and you don't qualify in some way, and I don't know what their criteria are, they also have a referral line to connect you to someone, and it should specify whether they are offering distance methodology right now. But some psychologists are still seeing people live, and it's a decision because they're considered essential services. And you may not have this technology necessarily. If someone doesn't have that, and they have an urgent need, it is still possible. They're taking precautions in the office like everyone else is to try to be sensible to prevent infection. But
Yeah.
they can still offer services in those circumstances, or we're just encouraging more distance ways of providing help in light of the circumstances. So.
Well, thank you very much for this, Troy. And you're always my go-to guy for any sort of advice and instruction in this area. And so thank you, and all the best. And, just we will talk to you again.
Thanks very much, and blessings to all of you.